There's a note-taking service also, so then I can generate notes for, and then create like a blog or several posts out of it. So Kiki, what questions do you have today?
Today, my first question is about the autonomic nervous system. Uh, I've heard, and I think I've also heard it from you, that low dose naltrexone can be activating for the autonomic nervous system. Can you explain a little bit why, and can it be mitigated by just going to a lower dosage? Because POTS went worse, right? Etc.
So I think that the easiest way to explain everything is go back to the mechanism. Go back to the mechanism of endorphin. So the modulation of everything, I think, really the central is endorphin. So if the dose is too high, you're going to deplete the you are going to deplete the endorphins. When you deplete the endorphins and you continue to take LDN, you're going to make the endorphin deficiency worse and worse and worse. And at some point, people are going to have autonomic side effects, like what? Nausea, vomiting, um, and just feeling like they're going to malaise is so bad that it feels incompatible with life. That kind of feeling. And some people say that, hey, I'm becoming very depressive and I'm becoming suicidal. I think that I've heard people saying that, and I think it's too bad because there's no reason for people to suffer taking LDN. I mean, even if they use the table that I developed or the starting optimal starting dose, there's no reason for people to suffer. So what you're talking about in terms of modulation of autonomic nervous system dysfunction is like dysautonomia and
Yeah.
POTS, or postural orthostatic tachycardia syndrome. And I don't think we understand that very well. But what I would say is that it's the decreasing of inflammation and neural inflammation and sensitization that contribute to the autonomic nervous system imbalance. And I think the glial cell modulation helps with that. And in LDN, I think there's a report saying that about 25% to 50% of dysautonomia patients feel better, reduce pain, reduce fatigue, orthostatic intolerance is better, GI is better. So, but it's not always like that, right? So, um, so if you look at the number that 30, 25 to 50%, it looks suspiciously like 33%. Remember, because I say that about a third of people can really experience fantastic results, and the other third needs a little more help, and then the other third seems to be not so much. But 66% is really fantastic, I think. And what are the side effects if you take it on the right dose, right? Not a lot. um, and they use LDN for autonomic nervous system issue is an off-label use, and it is being looked at. But I think that just looking at the fact that POTS and POTS have really gone out of dysautonomia has been so much more these days than before. Before I would see POTS maybe once in a year, but now it's everywhere. Dysautonomia, that's everywhere. And so dysautonomia, of course, makes POTS worse. So I think that the whatever happened after post COVID, I think the COVID may have made us all like MCAS state, or uh, more autoimmune state, and we're seeing it. And I think that people's brain probably have changed because people are a lot more aggressive, right, these days, and people there's more behavior that pre-COVID we didn't see it. So Penny,
So
welcome. You were going to ask a question last time, but you're having some connection issues. Is
Yes.
that so? Ask the question. You're here. I'm here, and we
Well, I wanted to ask you if you've worked with anyone that's had granuloma annulare, which is a rare skin disease that no one seems to have heard of.
Yeah. So the way to look at LDN is very simple again. It is what causes it? What causes granuloma annulare, which is a benign, self-limited, usually self-limited condition. Do they know what causes it?
No, dermatologist, doctor, and my primary care doctor, no, they've never really, they do not have a lot of experience with it. They tell me there's nothing they can do to get rid of it. There are like a couple drugs that you could take, but they have like a black label on them
Of
and they're
course, of
really
course,
hard on the liver. And I have a
of
liver,
course.
another autoimmune disease, which is of the liver, and that's primary biliary cholangitis.
Yeah.
So I was kind of hoping this might actually help me with both, but
It, so I think here's the way that when you don't know, understand the mechanism. The
mhm,
mechanism of the primary condition, the GA or granuloma annulare, is the histology shows that collagen is dead, collagen is degrading. So, and then it's got interstitial histiocytes and whatnot. So that means that something is killing the collagen. Something
mm,
is penetrating in between the cells, and then they what they say is that it there's a delayed type or a Th1 hypersensitivity reaction. What did I say? What sensitivity? Hypersensitivity.
mm,
So, and there's an interferon gamma driven macrophage activation and TNA alpha mediated matrix degradation. So, but they don't know the trigger. So they say they don't know, but they do know what happens. So the Th1, Th2 imbalance, we know that LDN can cause it. The only thing you have to be careful is that if it makes it worse, then LDN is not for you. For that reason, someone like you, in my practice, I would say let's start with baby dose because there's so much unknown.
mm,
Um, the because the but we do know that the granuloma annulare is got a reactive pattern that can be triggered by localized trauma, insect bite, sun exposure, and other sun skin insults. You know what that sounds like to me? It
mm,
shares some similarity with MCAS, doesn't it?
mhm.
MCAS can be uh, activated by trauma, activated by insect bite. Uh,
Well,
so,
this did
there's
come on, and oh, excuse me, it did come on right after I had surgery.
So that's yeah, and surgery can start with MCAS. What's MCAS? MCAS just means mast cell activation syndrome, but MCAS to me is immune derangement. What is good for immune derangement? LDN
Mm,
is one of the best tools. So, uh, it basically it's a benign condition. It's not infectious. It's not pre-malignant. It's not contagious. So I think that is it possible that LDN can be helpful? I think so. I think it can be helpful. I mean, they use phototherapy. They use steroids. If steroid can be helpful, then I think LDN can be helpful, right? And then and they use steroids. They use methotrexate. They use all these things that also LDN can be helpful. Notice that there's a lot of antibiotics they like to use: dapsone, rifampin, uh, minocycline. Do you know what that thing treats?
mm-mm.
Lyme disease.
What treats the Lyme?
The dapsone and rifampin,
Mm.
doxycycline.
Oh, okay. I
So it's
did
kind of
try.
interesting. It's a really
Yeah.
interesting because is it possible that in not you, but in some people with GA, is it possible they have hidden infection? Because
Mm,
now we are finding that Epstein-Barr virus is associated with autoimmune conditions
mm,
and lupus. So I think LDN makes sense. And then if the patient, like in my practice, when patients did come with the secondary condition, I did use LDN for it. Same thing with autoimmune hepatitis. And it's very rare, so I don't have outcome data. Because one of the weakness of being a doctor is that, especially in this system, is people come and go. Especially if it's cash practice, people come and go, and I can't really follow them. And that's why I like the membership model, because I do like taking care of patients. I cook for my wife. I clean the house and wash and fold the laundry. Not as well as she does, but she doesn't complain when I do it. So I think some people are like that. I'm like that. I like taking care of people, but I don't want to know what's going on. So that's why I use membership, so that it's harder. But people that, one of them I've been taking care of for almost 20 years, and I'm just really grateful. So LDN, if someone came in with your two conditions in my practice, I would just not do that, though. I would do multiple things. And in my blog, I talk about, what else to do. So you can look at my blog, and my blog is www.ifmsynergy.com.
Okay.
And then you can take a look at that. But I think the LDN for both conditions is not unreasonable. But if in my practice, because we don't know exactly what GA mechanism is, I would probably start, at least talk to my patients about starting lower dose, so that, because the last thing we want to do is make it angry. But
Right.
the
Well,
list of medications is a clue that LDN can be helpful, because
okay.
yeah, because
Well,
like
thank you.
steroids, well, I used LDN. How about like hydroxychloroquine? I used LDN. Methotrexate, I used LDN.
Mhm.
How about the people with Lyme, cyclosporine? I used LDN. And then biologics, I used LDN for that too.
Yeah, it
'Cause
seems like there's multiple things. That's why I was like, boy, wouldn't it be something if it could help with
well,
both?
just find someone who knows enough about LDN, and then work with that person, because your conditions are rare, and rare conditions, you do want to find someone who knows what they're doing, because there are variances. Everyone is an individual, so
Mhm.
you just have to you know. So let me move on to Charlie. Charlie, do you have anything? Last time you had microphone issue. I don't know if you still have microphone issue, Charlie. Charlie is our right and left-handed person, just with the Jill, and the two of them keep our community super safe. I'm going to skip you, Charlie. I don't know where you are. Tony, how are you? From Australia. 11:30 Saturday,
Thank you.
11:45 Saturday in Melbourne, I believe.
Correct. I am. Yeah, wanted to write a comment, but it didn't seem to let me.
I
So
beat
the
you.
article you posted on Fibro, and it was just amazingly awesome, and covered like 15 plus years of my research on leaky gut all in one document. So
Where?
I think
Which one?
everyone should read that.
Which one? Which one? The IFM.
It was the one that I initially couldn't get to, and you sent me
Oh
another
yeah,
link
that's the
to it.
IFM synergy.com. That's the and everything there is
Yeah, well,
also posted.
that article was just
Yeah.
amazing, and I think everyone should read it.
The funny thing is, Tony, now I'm doing I've written a lot of the articles, right? So I use that in my practice now, and everything in there is also in the Facebook group, and it's called SIBO Resolution, and it's a small group,
Yeah,
and I don't try to promote it, and the most people with SIBO, I think, is it's the mindset. They're not ready to get better, because it's very SIBO is I found SIBO to be the hardest condition to treat for some time, and it took me a year to figure out. And then after that, people who want to get better, I can help them. Rest of them, they're not ready. And it's, I think, really has to do with the mindset. If they have the mindset that they're going to get better, I can help them. Otherwise, I can't. And everything's written out in that article, right? It's
Yes.
yeah.
I will be right onto it when I finish moving.
When are you moving? Are you moving soon?
I've got the keys. I'm meant to be there cleaning now, but I wanted to join. Going to be out by the end of the month. Keys back to real estate, and yeah, so big month.
Are you in Melbourne, or will you be moving away from? Oh, I posted the article if anyone's interested. I think that's the one that Tony's thinking about. So, are you in Melbourne
Yeah,
still?
I mean it's about about 8 kilometres, still in the eastern suburbs, and yeah.
I mean, are you near like Ringwood, Lilydale?
Yeah. Between the two, not far from Ringwood.
Oh, cool. I've
So
never been.
I'm on one side of Ringwood now. I'm going to the other side, but yes, it's still not that far from Glen Waverley. You might know about Glen Waverley, no? Burwood,
I see
but yeah, not.
Croydon, and then there's
Yep.
yeah. Okay. So we'll stop here, but I think I know the general area where you are. Melbourne's supposed to be very nice. I think another place that, and I know Australia is huge, and it's really wildly separated in that it's just coastal. You know, like Adelaide is probably, I don't know, looks like a 6-hour drive at least from
Yeah. So
Melbourne.
last week you made a comment that in some places or areas can be quite racial.
Yeah.
The side of town I'm on is very multicultural and also has a high Chinese population.
But you know what?
The
Everywhere
Chinese
you
all
go,
like to buy in Glen Waverley because they all want to get their kids into Glen Waverley High School because that's free and it has the best reputation and results.
yeah. But I mean, looking at the Australia, it's just so amazing. Melbourne to Adelaide, that's probably 6 hours. Melbourne to Canberra is probably 6 hours.
12
No?
hours, 12, 13 hours
12
in the
hours.
car.
Okay, now I know better.
Yep.
So the Sydney is going to be almost a 1-day drive.
Yep. If you wanted to go to South Australia or to Canberra, allow at least an hour of driving. I also
Oh my
have a
God.
question about another article that you wrote that
Okay, let's talk about that.
I read. So the article around magnesium and the different types
yes.
of magnesium.
Yeah.
Yep. So I read that with great interest because over the last 4 years, every time I have a blood test, my magnesium is still low. So it's been increased every time. But my doctor has me taking a magnesium product called MagSup, which is actually magnesium aspartate DIHYDRATE 500 milligrams, which is an element magnesium of 37.4 milligrams per tablet. Just wondering where that fitted into the whole magnesium scale and what to consider.
So what they're using is an amino acid chelate of magnesium, and they do that because of magnesium. The issue is when you take lots of calcium, you get constipated. If you take a lot of magnesium, you go. And so citrate it would be a great one. So citrate is great for constipation. I think another one is oxide is really great. Glycinate is gentle on stomach, well absorbs, works for sleep, anxiety, stress reduction. Threonate goes to the brain, so it's supposed to help with memory, mood, and cognition. And then they have other ones like malate. They think that is helpful. The aspartate that they're using is probably to avoid the prokinetic movement of the magnesium. I don't think it's the best. It's not the worst. But at the end of the day, magnesium is magnesium. It's just so that I just always ask in my practice. I just ask people, hey, if you take magnesium, do you get do you tend to have loose like constipation or loose bowel? And then if people say, I have constipation, okay, you can take whatever magnesium you want to take. It might make your constipation better. When people say I tend to get loose bowel, then stay away from citrate, oxide. Try to take glycinate. I do think that glycinate is better. And if anyone's trying to treat the brain for whatever, then I think that threonate is probably the best form. And if people have chronic fatigue, and the other thing about the testing is the testing is not very accurate. They have the testing in the serum, testing in the red blood cell, but what you really need to know is like intracellular level. And there's only one place that tests that. It's in Berkeley, and they're backed up pretty horribly. They're very expensive. So I think you just talk to them and ask about the symptoms, and the symptoms will tell you how things are, because the symptoms.
Oh,
Yeah, Tony.
yeah. So for muscle spasms and cramps,
Glycinate.
would you still go with glycinate is the
Probably
best?
glycinate.
Yeah.
I think the glycinate is the best form because it goes to the probably glycinate. Some people threonate. I mean, the good thing about citrate is that if people are not having, people are constipated, you can use citrate for everything. It's cheap. It's just for and I think it's also very very person driven because the uh, believe it or not, LDN can be helpful for muscle spasms in the legs. Because in Western medicine, because there are two ways of understanding LDN. Is one way is through understanding the what medications are used. What medications do they use when you have really bad leg cramping, Charlie horse? They use Parkinsonian medication. Well, for Parkinson's, I've used LDN with moderate amount of success. So then you know that it can also help with the what do you call that thing? um, the cramping. And I have had some people help with cramping. First is magnesium because LDN still is a prescription medication. LDN magnesium isn't. And I just asked them, do you ever? I mean, do you get are you constipated? Do you know what constipation is? And people say yes. I live with it every day. It's then I say okay, you can use any form. Maybe use citrate, and then they're oh my god, this fixed two things. And it's that simple. You just ask them question. You listen to them, you ask them question, and then you use your knowledge and leverage your knowledge, and then you can help people. Kathy, welcome.
Thank
Do you have
you.
any questions?
Oh, well, I did have a question, and
Excellent.
yeah, look, and I know this is root cause, and the question I'm about to ask probably isn't, maybe it is root cause or not, but I had a question about hydrogen water because
Yeah, I remember. I remember. Yep.
Oh, okay, great. Yeah, because some people in the chronic fatigue community have said they've felt better with it. And I understand like it helps some free radicals, which can be a bit of a burden for people with chronic fatigue syndrome. And I was just wondering what your take on it was. What do you know about it? And like, do you think it's like something worth spending the time and money on trying in your experience?
So I didn't really know what it was until I looked it up. And I remember when I went to visit Singapore with my wife, and we stayed in a very nice hotel, and they had free hydrogen water. So I said, I don't know what this crazy thing is. So I drank it. I don't know if I felt any different, but the idea is that it's H2O plus H2 hydrogen. So that's why it's hydrogen rich water. And what that means is that there's water, but there's also the gas hydrogen that is free dissolved gas that can potentially interact biologically after ingestion. So the idea is that hydrogen is very small, it's neutral, it can diffuse across cell membrane into mitochondria. That's the idea. So I think with everything, I think it can help with inflammation, apoptosis, and redox balance. And as with everything else, hydrogen water, um, I don't think there's a lot of research. The companies that make a lot of money off of these products, they don't have to do research. As a matter of fact, if they did research, they may have to publish the negative finding. So they will not do that. So basically, you get the water, filtered water probably, and the bubble hydrogen gas under pressure, and then or use electrolysis devices, or they dissolve magnesium-based tablets that generate hydrogen in the water. So, but the crazy thing about this would be very believable if you had a hydrogen machine at home, and then you bubble the hydrogen at home, and then you drink it, right? But most of the times, what happens is it's in a container, and the container has been sitting for how only God knows how long. The longer it sits there, the more of the hydrogen runs away. You know that hydrogen and helium can run away from Earth atmosphere because it's so small. So I mean, so I
Yeah,
think that
I
yeah,
understand that once you make it, you need to consume it immediately.
yeah,
Otherwise, there's no point. It just turns into same old
wa-
boring water. So yeah.
more expensive water. It's water that's more expensive without hydrogen if the longer you keep it. So the reason why is that one of the clinics I work Monday, Tuesday, Wednesday in Fredericksburg, Texas, and I see people in real life there, and they have an ozone machine, and they have a rule: in 20 minutes it has to be used. So if ozone is like that, hydrogen probably within 20 minutes you must drink it. So that would work in a hydrogen bar, but not hydrogen bottle, because there's enough time for the hydrogen to go through and escape because it's small enough. Any other questions? We have 2 minutes.
I do. My
Okay.
question is, last week we talked about microglial cells,
Mhm.
and people who
That's a
have
good question.
TBI probably has the microglial cell problem, which I think LDN helped
Mhm.
me with. For concussion TBI, there are doctors that say because you get the knock, it knocks your pituitary